Dr. Maya Thompson adjusted her sunglasses as she walked through the sliding doors of St. Michael's Hospital. She had just returned from a medical conference in Chicago, exhausted but satisfied with the knowledge she'd gained. As the hospital's newly appointed chief of internal medicine, she wanted to check on a few patients before heading home, but fate had other plans. As Maya passed through the emergency department, a sharp pain suddenly struck her chest. She stumbled, catching herself against the wall. Her medical training kicked in immediately. She recognized the symptoms. Her heart condition, the one she'd managed carefully for years, was flaring up. "I need help," she called out, her voice strained. A nurse at the station looked up, a woman in her 40s with blonde hair pulled back in a tight bun. Her name tag read Sharon Miller. Sharon's eyes swept over Maya, taking in her casual jeans and jacket, her natural hair, her brown skin. The nurse's expression hardened almost imperceptibly. "Take a seat in the waiting area," Sharon said dismissively, turning back to her computer. "I'm having chest pains," Maya insisted, pressing her hand against her chest. "I think it's my heart." Sharon barely glanced at her. "Everyone thinks they're having a heart attack. You'll have to wait your turn like everyone else." Maya looked around the nearly empty waiting room. There were only 2 other people there, both appearing stable and comfortable. "Please, I'm a doctor." "I know my symptoms, a doctor?" Sharon's laugh was cold and mocking. "Sure you are. Look, we get people in here all day trying to jump the line. Some of you people come in here for drug-seeking behavior, and I can spot it a mile away." The words hit Maya like a slap. "Some of you people." She knew exactly what Sharon meant. "I'm not seeking drugs," Maya said firmly, despite the growing pain. "I have a documented heart condition. I need to be seen now." Sharon rolled her eyes. "I'll get to your paperwork when I have time. Now please, go sit down before you cause a scene." Maya's legs felt weak. She made her way to a chair, pulling out her phone with trembling hands. She wanted to call her colleague, but the pain was intensifying. She watched as Sharon laughed with another nurse, completely unconcerned. 20 minutes passed. Then 30. Maya watched as Sharon admitted an elderly white man who arrived after her, immediately taking him back despite his complaint of minor back pain. Then a young white woman with a sprained ankle was wheeled past. When Maya approached the desk again, Sharon didn't even look up. "I've been waiting almost 40 minutes, Maya said, her voice weaker now. "My chest pain is getting worse." "I told you to wait," Sharon snapped. "You know, if you really were a doctor, you'd have health insurance and your own physician. You wouldn't be clogging up our ER with your drama." Maya felt tears of frustration and pain welling up, but she blinked them back. She refused to give this woman the satisfaction. Another 15 minutes crawled by. Maya's vision was beginning to blur when she saw Dr. James Chen, one of her colleagues, walking through the ER. "James," she called out weakly. James turned, and his eyes widened in shock. "Dr. Thompson?" "Maya? What are you doing here? Why are you in the waiting room?" He rushed to her side, immediately checking her pulse. His face went pale. "You need to be in a bed right now. Why hasn't anyone seen you?" "I've been here for almost an hour," Maya whispered. The nurse at the desk, James's jaw clenched. He helped Maya to her feet and supported her as they walked past the nurse's station. Sharon looked up, finally showing alarm. "Dr. Chen, I was just about to save it," James cut her off. "Get a gurney and a crash cart to room 3 immediately." Sharon's face went white as she suddenly realized something was very wrong. She scrambled to follow orders, watching as James carefully helped the woman in casual clothes into the examination room. Within minutes, Maya was hooked up to monitors, and a team was surrounding her. James administered medication for her heart condition while other doctors and nurses worked efficiently around her. In the hallway, Sharon nervously approached Dr. Patricia Williams, the ER director. "Dr. Williams, about the patient in room 3, you mean Dr. Maya Thompson?" Patricia's voice was ice cold. "Our new chief of internal medicine? The woman who now oversees this entire department?" Sharon's face drained of all color. I didn't know." "You didn't know? Or you didn't care?" Patricia's eyes blazed. "I've been reviewing the security footage and the time-stamped records. Dr. Thompson presented with clear cardiac symptoms. You dismissed her, mocked her, made racist assumptions, and let her sit in agony for nearly an hour while admitting patients who arrived after her with minor complaints. I thought. I mean, she wasn't dressed like a doctor, and Stop. Just stop," Patricia said. Even if she wasn't a doctor, even if she was unemployed and homeless, she deserved the same quality of care as every other patient. You took an oath to care for all patients. Instead, you let your prejudice nearly cost someone their life." Sharon's hands shook. Is she going to be okay?" "Thanks to Dr. Chen's intervention, yes. But that's not thanks to you." Patricia crossed her arms. "You're suspended effective immediately pending a full investigation. Security will escort you out. We'll schedule a hearing, but I'm recommending immediate termination." Tears streamed down Sharon's face, but Patricia felt no sympathy. How many other patients had Sharon treated this way? How many people had suffered because of her bias? 2 weeks later, Maya had recovered and was back at work. The hospital had completed their investigation and found several other instances of Sharon providing substandard care to minority patients. Sharon's nursing license was under review by the state board. Maya called a meeting with the entire ER staff. "I want to share what happened to me," she began, standing before the assembled nurses and doctors. "Not because I want sympathy or revenge, but because I need you all to understand something crucial." She took a breath. When Nurse Miller saw me that day, she didn't see a doctor. She didn't even see a fellow human being in distress. She saw her own prejudices and assumptions. And those assumptions nearly killed me. The room was silent. But here's what I want you to know. I don't believe Sharon Miller is uniquely evil. I believe she represents a systemic problem in healthcare. Studies show that Black patients' pain is systematically undertreated. Black women are 3 to 4 times more likely to die from pregnancy-related complications. These disparities exist because of implicit and explicit biases. Maya looked around the room, making eye contact with her colleagues. "We're implementing mandatory bias training for all staff. We're creating a patient advocacy system. We're reviewing our triage protocols. And we're committing to tracking and addressing any disparities in care." A young nurse raised her hand tentatively. "Dr. Thompson, how can you be so calm about this? Aren't you angry?" Maya smiled sadly. "I'm furious. But anger alone won't fix this system. What happened to me happens to thousands of Black patients every day in hospitals across this country. Many of them don't have the privilege of being a doctor. They can't call a colleague to intervene. Their pain is dismissed, and sometimes they die because of it." She paused. "So yes, Sharon Miller will face consequences for her actions. But my real goal is to make sure this never happens again, not to me, not to anyone else who walks through those doors." Dr. Chen spoke up from the back. "We're with you, Dr. Thompson. This hospital will do better." 6 months later, St. Michael's Hospital had become a model for addressing healthcare disparities. Maya had implemented comprehensive reforms, including mandatory implicit bias training for all staff, a patient advocate system that allowed patients to report concerns, blind triage protocols that prioritized symptoms over appearance, regular audits of patient care to identify disparities, a diverse hiring initiative to better reflect the community they served. Maya received letters from patients thanking her for the changes, many sharing their own stories of being dismissed or mistreated. As for Sharon Miller, she never returned to nursing. The state board suspended her license, and she faced the reality that her prejudices had nearly cost someone their life. In victim impact statements, several other patients came forward with their own experiences of Sharon's discriminatory treatment. One evening, Maya received an unexpected letter. It was from Sharon. "Dear Dr. Thompson, I know I don't deserve your forgiveness, and I'm not asking for it. I'm writing because I need you to know that I've spent every day since that night confronting who I really am and what I did. I was raised to see people like you as less than, and instead of questioning that, I let it guide my nursing practice. I convinced myself I was a good nurse, but I was only a good nurse to people who looked like me. What I did to you was attempted murder through negligence. I understand that now. I'm in therapy, working to unlearn decades of racism. I've lost my career, my reputation, and I'm facing legal consequences. But honestly, none of that compares to the weight of knowing I almost killed you because of my hate. I don't expect you to respond to this letter. I just needed you to know that your words at that staff meeting changed something in me. You spoke about systemic change, about not seeing me as uniquely evil but as a symptom of a larger problem. That grace, even after what I did, made me finally see the humanity I denied in so many patients over the years. Will spend the rest of my life trying to do better, to be better." Sharon Miller. Maya read the letter twice, then carefully filed it away. She didn't respond. Sharon was right that she didn't owe her forgiveness. But she felt a small sense of hope. If Sharon could change, perhaps the system could too. As Maya walked through the hospital's corridors, she saw the changes everywhere, diverse faces among the staff, new protocols being followed, patients of all backgrounds receiving attentive, compassionate care. The work wasn't finished. It would never be finished. But it had begun, and that night, when Maya went home to her family, she held her children a little tighter, grateful that she was alive to see another day, and determined to build a healthcare system where everyone, regardless of the color of their skin, would receive the same life-saving care. Author's note: healthcare disparities are real and deadly. Studies consistently show that Black patients receive inferior care and have worse outcomes across nearly every health condition. This story, while fictional, represents experiences that happen far too often. We must all commit to recognizing and dismantling bias in healthcare.